A very good morning once again, and welcome to our Twitter Jabs 2, where we deliberate on conversations that are trending on social media. And today is World Health Day, and just like we talked about in the Twitter Jabs 1, it happens every year on the 7th of April, and today is World Health Day again. And the theme is our planet, our health, and this goes back to how we conserve our environment, what we do with our environment as well, because in the long run it does affect us in one way or another. My name is Agi Owase, and joining me on this conversation is a lady who is from a non-governmental organization, and that is Uganda National Health Consumers Organization, and her name is Mabel Musinguzi. Good morning, madam.
Good morning.
Thank you for joining us in Sunrise at Sea this morning.
Yeah, thank you so much for inviting us.
And happy World Health Day as well.
Happy World Health Day too.
Okay, for the benefit of our viewer, would like you to let us know on what is the role of Uganda National Health Consumers Organization?
Okay, thank you. Good morning, our viewers. Uganda National Health Consumers Organization is an advocacy organization registered in this country as an NGO. And we operate nationally, meaning that we work in different districts in this country.
Yes.
And we do basically advocacy for the right to health. And we do this in doing different interventions, ranging from teaching people about their rights and responsibilities so that they look at health as their right, not a privilege. Mm-hmm. So we teach them about that, but also we teach them about their responsibilities so that they have a stake in health, mm-hmm. but for prevention, but also ownership. We want, people to know that this is their health. They have to be responsible. If, for example, it comes to prevention, like you have to sleep under mosquito net, you have to drink clean water. So that is your responsibility as a human being. Mm-hmm. So we empower these consumers in that area. We also do policy advocacy, and in this we are looking at different policies, whether they actually address the needs of the consumers. We do establish some mechanisms and some structures at community level that facilitate consumer engagement with health providers. First, we also teach health users, health providers about these rights of patients, mm-hmm. But also about their needs. We emphasize their needs. We look at their, for example, remuneration. We look at their accommodation, different things, and then we try to bring them on board to see that they are able to do what they are supposed to do. So we facilitate that engagement also between the consumers and these health providers so that there's some sort of harmony and working together for improved health outcomes.
Okay, now in relation to the celebration of World Health today and the theme, which is Our Planet, Our Health, how does the Uganda National Health Consumers Organization come in? How does it, because you're talking about you're more focused on the health, the people's health, and how mostly it's about their personal health. So how does this relate to the theme of the celebration of World Health Day today, which is Our Planet, Our Health, which regards to conservation of the environment and how in the long run it affects the health of people? Let's say when trees are cut down every now and again, how it affects the air that people breathe and how it later on translates into the diseases like cancer and all the other diseases that come due to poor conservation of the environment. How does it relate to that?
Thank you so much. The World Health Organization Day, which is really the day to celebrate the work of World Health Organization, and the focus on our planet, our health, is really very relevant and timely. Looking at how the environment is in a way affecting almost all of us, knowingly or unknowingly. So when we talk about this topic, we are looking at not just health, but well-being. We are looking as a human being, not just whether you are sick from malaria or something, but the way you live. It determines the health that you have. If you live in a polluted environment, like we see these fumes, we see smoke all over, in the end it is going to affect you. And that's why we are seeing increased cases of respiratory diseases. You see almost everyone now has allergy. You see, you know, we have this cough, we have this also these cancers. So in a way, even when people don't know, we are being affected by the environment. That is just on one side effect. But we also have the human activities, the interaction with the environment that has affected. I usually use an example of, you see, we have constructed almost all, in most of the cities. Uganda is urbanizing, and for example, the water that used to go down where we have constructed now, we don't know, we are not aware where it is going, but it is going somewhere. And that somewhere, of course, we'll see the effects. And that's why we see, you know, lakes are flooding, we see people are being displaced, we see floods all over, we see prolonged droughts, but it's because of the you know, the activities that we do without actually thinking about it.
Yes.
So it is important that as a country we focus. First we need to bring everyone on board to appreciate what we are going through. By, you know, empowering these different people, teaching them the effects, and then involving them in addressing or living sustainably. Because if we don't think about tomorrow, then we are likely also to you know, to suffer even more.
Okay.
So this topic has like 3 issues that we need to critically look at. One is how do we involve the common person in understanding, appreciating, and addressing the effects of environment.
Yes.
Then 2, we need to look at also justice. We actually need to look at justice. There are people who are paying for, you know, environmental degradation when they have not contributed to that. Of course, this is a global discussion, but I think even at a country level, we need to look at it. There are people who are taking over our swamps.
Yes.
They are constructing there.
Yes.
And you know, these are powerful people. But at the end of the day, you know, when I have contaminated air, then I'm suffering. And in most cases, it is the common person who suffers, the person who cannot even afford the health costs.
Yes.
Those big powers, you know, destroy the environment and no one talks about them. And at the end of the day, they are in ACs, houses with ACs, and, you know, very comfortable good.
Houses.
They can travel to USA for treatment.
Care,
yeah.
yes.
Yet, you know, the effects actually being borne by the common person. So we need to look at justice. We need to have a discussion around that area. Everyone has to be accountable for the actions that they do.
Okay.
Yeah.
To interject a little bit on what you said about about justice, how do you intend to tackle this issue of justice? Are you planning on bringing the people who are building in swamps and doing all these outrageous things on the environment? Are you planning on bringing them to book? Are you planning on taking them to courts of law? Are you planning on sitting on a round table and then deliberate on these concerns, and you present to them and you say that you see, much as it does not affect you, because in the end you will go back to your very comfortable home where there is AC and where you can afford medical care abroad, but there is a common person who can't afford that. So how are you planning on tackling that issue?
Yeah, so we are sort of starting a discussion with different stakeholders, of course trying to bring in many people on board to look at this and see you know, some of the ways that we need to address some of these environmental issues. But we are also working with different groups currently. For example, we are looking at how we can help communities harvest water so that they reduce on the incomes, they reduce on, on the costs that they have to pay. Because there was a study that was done in 2020 which shows that 22% of the incomes of people living in slum areas in Kampala, 22% of their income is spent on buying water.
Yes.
So this is really expensive. So someone who earns like less than 5,000, then they have to pay almost that 2,000 to water because the jerrycan is around 500. Then they have to choose whether to buy water and then drink or bathe, or actually to buy chapati and, feed.
Yes.
Yet we see there is a lot of water that is from rain. If this water is harvested, then we can reduce on this, on the cost on water. We can also help to protect the environment because we are reducing on the water that runs back to flooding and these lakes. But also we are going to improve the health of the people because they will have enough water to use, and in the way improve sanitation and hygiene and sanitation. So that is one of the interventions that we are doing. Okay. But generally we would appeal to every Ugandan to actually get interested in this issue of environment and our health. Yeah.
Okay, while you're talking about every Ugandan should be interested in the issue of health and how to conserve the environment, I'd like you to give us an in-depth analysis on how, to what extent does the planet contribute or affect our health? Because people out there may not actually know how it may affect our health.
So the national statistics are not there because there's a lot of research that is done. But WHO shows that 13 million, we lose 13 million people every year due to environmental effects.
Yes.
Yeah, every year. That is globally. When you calculate, per day, then you get the real statistics. So you see that this is actually a big percentage, and the biggest percentage of this number is actually in developing countries where Uganda falls, and yet we are unable to meet the health cost. We are spending a lot of money, yet our budget is actually small for health.
Yes.
So as a country, it's not just always asking for money, put money in health, in medicine. We also, and a department on environment in the Ministry of Health and other sectors, especially like at Prime Minister's office, we need to get involved in ensuring that actually these things that bring such diseases, increased diseases, then we find a way of addressing them and live sustainably.
Okay, now we are talking mostly about the downsides and how, especially, let's focus it back on Uganda, on how people are failing to conserve the environment, and it's affecting our health in the long run. You talked about respiratory diseases like cancer and the like. But also let's talk about the achievements. What are those achievements that we have achieved as a country, Uganda, before we cross borders to the world? What are those health milestones that we have achieved in this country?
So thank you so much. As a country, we have made tremendous progress in health, ranging from infrastructure. You see, at least almost all Ugandans, almost 97% of Ugandans live within 5 kilometers of a health center, which was not so just years back. So, and that is a good start. So we have infrastructure, at least we have health facilities. We have also capacity in terms of human resource. We are able to do a number of things which is not to do. For example, this Cancer Institute is a point of reference in East Africa. We have many people who are coming in, though we have not really reached there. Yeah, there are still so many challenges, but this is really worth noting. And then we see, even though the money is not yet enough, which should be like 15% of the national budget, but we see we are moving, which was not before. So we can really say that there is some progress in terms of health. And also, you know, many people are actually empowered. They are interested. They also participate in prevention. There's a lot of knowledge being shared, but also the technology that is available. So there is some improved health-seeking behavior in the communities. I think which, if well tapped, then they can be able to prevent or participate in preserving the environment, especially if they know the effects. The challenge is the knowledge levels. Many people don't know that actually we are being affected by the environment.
Yes.
Yeah, we just see flooding in the health facilities, people sick, complaining of this and that. But majority of people don't know that the effects are coming from the environment.
Or maybe they actually know the effects that come from that, but you know, sometimes they talk about issues, they present their issues to their leaders, what is happening, the challenges that they are going through, and they are never tackled, they are never worked on. So while you highlighted some of the achievements of the health sector in this country, I would like you to talk about the challenges, the challenges that need immediate intervention, because there's quite a number of challenges, but then there's those that need immediate intervention. What are those challenges that you think?
So number one, I think, is corruption. We have a lot of corruption, especially when it comes to environment, such issues that do not attract the public eye so fast.
Yes.
Yeah, we have people who have constructed factories in the middle of residence, residential area, which is not supposed to happen, but because someone pays something or has an upper hand, then they construct. For example, in 2014-15, we actually made a tobacco factory just in Chireka here, Shift. Because they were polluting the whole area, and we registered some cases of cancer because of that pollution from. And you wonder how such a factory like that can be in a residential area. Because we wrote to NEMA asking them, and actually a needs assessment was done. Impact assessment was done. So, and there are many places where we find factories where those, even the factories are not doing what they are supposed to do, like manage well the waste, or even protect the environment. We find they are putting all the waste in the lakes, even talk about these hotels. And it's as if we don't have policies or laws, yet we have these policies, good policies, and we have these good laws. But when it comes to enforcement, then corruption takes an upper hand. So that is one of the biggest challenge that we have, to address such issues. Then there is the issue of capacity. I think most of these government institutions do not have enough capacity to enforce and, protect the environment. When we talk about like NEMA, when we talk about like Ministry of Water and the environment, the human resource that is there is really not that to the task, but also the representation is not there. So we have the issue of capacity, which goes back to funding that is generally not enough. Also, the other issue is lack of prioritization. I think government has not taken to that task. I think government has not really appreciated the impact of this environment on health and on the economy.
Yes.
So there's need for prioritization. We need to have this issue. You see, like the Minister for Environment, Beta Anwar, what she was saying, that she's not supported. She came up in the morning and said, I'm banning Kavera. And the next day, we see Kavera everywhere.
Yes.
So I think we need to also address the issue of capacity. Then we need champions. We need champions. Then the other, maybe last from my side, the other big issue is the knowledge level. When, you know, in this country, those ones who shout loud are the ones who are hurt. If people are involved and they know, they relate the environment and the rising cases of diseases and, you know, those issues, then they are able to wake up and demonstrate and say, we can't allow Kavera. We can't allow these bottles that end in lake. You just look at the Lake Victoria water.
Very polluted.
Very polluted, yeah.
Yes.
So I think the knowledge levels among the you know, the population is also not enough.
Okay.
Yeah.
Okay, as we wrap up this conversation, I would like you to give us your final remarks or a message that you could send to the Ministry of Health in this country and to the World Health Organization as well, and to the people out there as we celebrate this World Health Day.
Yeah. So thank you so much. I think basically as health consumers organization, as Ugandans, we appeal to people to get interested in this issue. It starts with me and you. How have you conserved the environment for your own health, for your country, for the economy, for you at an individual level? What are you doing? What can you do? I see there are people who have, like what we are talking about, harvesting. They're harvesting water, and this is saving them. There are people who are, you know, making these briquettes, charcoal, the briquettes. That one, in a way, saves the cutting of trees. Because if you are using maybe a sack of charcoal for a month, and then you are able to reduce because of these briquettes, then those are initiatives that need to be supported. But it starts with me and you. For you at wherever you are, what have you done to conserve the environment? Yes. Yeah, so I also appeal to government, to officials, to NEMA, to environment. We need to bring this discussion. We need to have discussion as of yesterday.
Yes.
Yeah.
Okay, thank you so much, Miss Betty
Mebo
Musinguzi, for joining us on this conversation as we're deliberating on the World Health Day, and whose theme is our planet, our health. Well, that is what we had for you on this conversation. And remember, we are still continuing with Sunrise at Sea. Coming up is our wellness, beauty and lifestyle segment. And since it's the month of Ramadan, we are talking about veiling. Stay at sea.